came out with Prem phase, but
I can take that. Actually, there are a lot of things that we can do, and that's one of the reasons we're here, is to introduce a lot of this stuff to all of you.
Bring your appointment books.
But there's definitely things that we can do to check your diabetes and talk to you about the Lipitor and balancing your hormones. We find that if we balance your thyroid and your other hormones, the cholesterol HDL ratio improves, the cholesterol comes down, as does your triglycerides. So there are a lot of things that we can check and work towards doing that, where Lipitor maybe doesn't necessarily help you.
It doesn't?
Well, it lowers the cholesterol, but there's a lot of side effects with Lipitor.
Yeah, there's. So we have a 20-page handout on the dangers of Lipitor. The problem with the statin drugs is that just about every animal study with statin drugs at normal doses that they give humans has increased cancer risk. And there are not long-term randomized studies looking at cancer. So that's a problem. In terms of diabetes, I mean, there's so many things you can do, and you go, the endocrinologist say, oh, you're fine, your diabetes isn't too bad, your hemoglobin A1C is 6, 7. We want it normal, and that's what we shoot for. We usually do get that. So when you place all the hormones, the insulin comes down, the weight comes off, So it's, instead of just looking at, let's just look at your diabetes, look at everything, and that improves significantly.
I was going to say part of the question was basically what happens when you come, if you were to come to see us. Well, what's typical is you come in and of course our lovely staff would greet you. You also get your vital signs done. We spend about an hour with each patient for the first visit, and then in that time you have ample time to tell us what's going on. In fact, I love it when patients, I said, this is your opportunity to complain. Let's let it out. Let's hear what's going on, because there's nothing nicer as the weeks pass by and you see you again to say, hey, do you have this problem? No, it's gone. Do you have this problem? No, it's gone. You go down the list and see the problems go away, and that's very gratifying as a physician. So usually during that first visit, about an hour, we do a physical exam and then send you for blood work. And then the follow-up visit's about 2 to 3 weeks later, where we go over the lab work. And it's usually extensive lab work. We don't do cursory lab work because by the time you've got to us, you usually have pressing issues that need to be taken care of that haven't been taken care of before. So hopefully that helps clarify some of the questions.
Absolutely. About probably 35–40% of our patients are men, and they have the same issues, andropause, and men are low testosterone. It's funny, men are much lower testosterone now. In fact, the lab calls me and says, it was about 6–8 months ago, and says, well, I'll let you know we're lowering the normal range for testosterone for men. I'm like, why? They said, men are lower now. Yeah, and it's very true, and they are. I'm having guys come in at 25, 35, very low testosterone levels from toxins, pesticides, pollutants, plastics, drinking out of plastic water bottles. Lowers testosterone, lowers your thyroid. Yeah, so, major medical journals showing this, yeah. Essentially, we give you, for the office visit, we give you a super bill with all the coding, and typically if you have a PPO, you get about 50 to 70% reimbursed, historically, we're finding. The labs are billed directly to your insurance. So HMO, typically if it's HMO, we'll try to get your doctor to do them, and sometimes we can also get them slipped through, but typically HMO, standard answer is no unless we can talk to your doctor, and oftentimes they'll do it. Yeah, in terms of birth control pills, and the ethinyl estradiol will go through the liver, increase again the binding proteins, drops your thyroid, drops your adrenal function, increases clotting factor. So when you look at the risk of someone smoking, it's going to malpractice to put them on birth control pills if they're over 35, and so it can it typically increase a lot of risk. Some studies are showing it's not as bad as we think, but regardless, we'll put people on birth control pills on progesterone along with it, just for the protective effects. Also prevents the PMS and all those other effects from the birth control pills. Yeah. In terms of the water bottles, if you look at the bottom of the water bottle, there's a little triangle with a number. And the lower the number, the softer the plastic, the more that leaches out. So I found if you, especially have the water bottle in your car, leave it in the heat, leaches out. A study, Journal of Endocrinology and Metabolism, a major endocrine journal, showed it lowers your thyroid. And if they're selling now, I think at Whole Foods or that, yeah, basically the non-leaching plastic, but the problem is you can get it from a plastic water well, pour it in there. Doesn't. We actually have glass bottles, but I think they've stopped selling those, like the Sparklets bottles, but they're going to discontinue those. Yeah, they have a very toxic environment. So basically you're asking about if you have no symptoms, can you come in and get everything checked? And absolutely, because we want to look at preventative medicine. We want to stop something now before you're like, hey, I'm feeling terrible. I've had a stroke or heart attack or diabetes, so we look at those very closely. Yeah. Oh, absolutely. And one of the major benefits of bioidentical hormones is osteoporosis, is preventing osteoporosis and reversing it. And we get, nice increases. We get most people off Fosamax and the other bisphosphonates, and really increase bone gain. We look at what helps bone loss, prevents bone loss. Estrogen helps. Progesterone is better than estrogen. Testosterone is better than both of them, and then growth hormone is probably the best long term, but it takes a while with growth hormone. Yeah.
Is there a drug company?
No, that's a reason why it hasn't really taken hold. There's no major drug company selling bioidentical hormones because there's no drug reps going around the doctor say, here's our drug. So it's, again, really patient-driven, and there's no patent because it's natural. So there's no reason that they want to really start selling it because the company down the street can also sell it. Yeah. And with prostate cancer, we actually have a lot of people come in just for prostate cancer. And you look at the studies on testosterone, and no increased risk for prostate cancer. And actually, nice studies showed if you give dihydrotestosterone with, like Advil, it kills prostate cancer cells. And so it's kind of a regimen that we do for if you have prostate cancer. But in terms of preventing it, even progesterone in men, great prevention for prostate cancer. Absolutely. You look at especially low thyroid, and people who are low thyroid, you give them thyroid, their blood pressure comes down. Also, the problem with the oral estrogen, again, tends to increase blood pressure because you tend to increase water retention. Transdermal does not. Yes, so we treat a lot of fibromyalgia, chronic fatigue syndrome. We actually have clinics across the country where Dr. Sharp is a fibromyalgia expert as well. And yeah, hysterectomy oftentimes will, that's basically a start for fibromyalgia. Hormones drop, boom, and they get all the other symptoms. So bioidentical hormones are a very important part of treatment for fibromyalgia and chronic fatigue. Yeah, so we have the chronic fatigue and fibromyalgia clinics for those conditions. Yeah. Typically, the PMS is a progesterone deficiency. So basically, when you have your period, the hormones drop. First part of the cycle, the estrogen starts rising. Second part, the progesterone should rise. If it doesn't, you get PMS, so very irritable. You're at higher risk for fibroids, breast cysts, all those things. So treatment oftentimes very, very high doses of progesterone. Progesterone is very calming. And you got to give it the right time of the cycle, and it's, oh my gosh, that PMS almost always significant improvement. Well, you can do that. I mean, let's just wipe out your periods. I mean, you're gonna pay for that, and in other ways, say, well, they can put you on the every 3 months birth control